Presbyopia is the inability to focus on objects up close. In normal vision, light passes through the cornea and then through the pupil, which is actually a hole in the colored part of the eye. It continues to travel through the lens. After light enters the eye, it focuses at a single point on the retina at the back of the eye. At the retina, the image is converted to electrical signals that are sent to your brain. In normal vision, the lens is elastic and can change its shape to focus light onto the retina. The focusing power of the eye depends on the amount of elasticity in the lens. As we age, the elasticity in our lens decreases and causes presbyopia. A presbyopic person sees faraway objects more clearly, and light from nearby objects focuses behind the retina, causing these objects to look blurred. Symptoms of presbyopia may include tired eyes, headaches, and blurred near vision. But people often notice the first symptom of presbyopia when they have to hold reading material farther away from themselves in order to focus it more clearly. Presbyopia normally occurs in people over the age of 40. Your doctor may prescribe reading glasses created especially for your vision deficiencies. During normal vision, light passes through the cornea, which is the clear covering of the eye, and then through the pupil, which is actually a hole in the colored part of the eye or the iris. Light then passes through the lens where the image is focused onto the retina at the back of the eye. The image is then converted to electrical signals that are sent to the brain. Cataracts can cause your lenses to become cloudy or opaque, preventing light from passing clearly to the retina. However, a surgical technique can restore your vision. First, an ultrasound probe is used to soften the natural lens, which is then suctioned from the eye. Next, a plastic lens is inserted into the capsule that previously contained the natural lens. The new lens is secured via two flexible plastic struts that curve out from the central piece. An implanted lens functions like a natural one, focusing light on the back of the retina and restoring vision for those with cataracts. In normal vision, light passes through the cornea and then through the pupil, which is actually a hole in the colored part of the eye. It continues to travel through the lens and focuses the image onto the back layer of your eye, called the retina. At this point, the image is converted to electrical signals that are sent to your brain. A person who is nearsighted sees nearby objects clearly, but light rays from distant objects focus in front of the retina, making distant objects blurred. A farsighted person sees faraway objects clearly, and the rays from nearby objects focus behind the retina and causes similar blurred vision. Near or farsightedness can be attributed to a combination of factors: the curvature of your cornea, the shape of your eyeball, and the condition of your lens. Macular degeneration, commonly referred to as ARMD, is the leading cause of blindness in the United States today. Normal vision occurs when light enters the eye through the cornea, then passes through the pupil and the lens, focusing in a small area on the retina at the back of the eye. The macula is located in the center of the retina and provides us with detailed, straight-ahead vision. It allows us to see fine details, like facial features and fine print. When the macula deteriorates because of aging and a breakdown of its delicate tissues, objects may become blurred, distorted, and lose their color. It's also possible to see a dark or empty area in the center of your vision. A variety of low vision devices, including telescopic and microscopic lenses, can be prescribed depending on the severity of your loss of vision. Central vision that is damaged from macular degeneration cannot be restored, but can be compensated for with these optical systems. Normal vision occurs when light enters the eye through the cornea, then passes through the pupil and the lens, focusing in a small area on the retina at the back of the eye. People with low vision have less usable vision, but they almost always are not totally blind. Low vision is the inability to see clearly, regardless of attempts to correct vision through the use of standard prescriptive lenses, surgery, or other medical treatments. Low vision can be the result of a birth defect, an accident, or other diseases like macular degeneration, diabetic retinopathy, retinal detachment, cataracts, or glaucoma. Low vision can cause an overall blurred image, a loss of central, straight-ahead vision, making it difficult to identify objects in front of you, or loss of peripheral or side vision. Depending on the eye condition, low vision can exist in any combination of the three forms described. There are many different products available for people with low vision, such as special lenses, magnifiers, high-intensity lamps, and telescopes. A low vision specialist can prescribe the appropriate devices for you. In normal vision, light first enters the eye through the cornea. The cornea is smooth and round, then through the pupil, and then the lens. As light enters the eye, it focuses at a single point on the retina at the back of the eye. LASIK surgery is for people who are nearsighted. That's where distant objects are blurry because the images are focused in front of the retina instead of on it. LASIK surgery uses a laser and a cutting tool called a microkeratome to form a flap on the cornea. The corneal layer is flipped back and the inner layers of the cornea are treated with the laser. The laser will change the shape of the cornea so the images entering the eye will strike the retina more directly and help sharpen your vision. Glaucoma is actually a group of diseases. For now, let's talk about how our body maintains pressure in the eye. In our eye, we have 3 fluid-filled chambers. The fluid is clear in the front 2 chambers and is thick and jelly-like in the back chamber. Normally, this fluid is responsible for maintaining the pressure inside the eye and helps keep the shape of our eye intact. The fluid is generated in small glands near the muscles that control the lens in the middle chamber. The fluid drains out of the front chamber at the place where the iris, the colored part of our eye, meets the cornea, the clear protective coating. It drains in a tiny canal called the canal Schlemm. People with glaucoma have poor drainage and too much pressure in their eye. There are several ways that this can occur, but 2 examples we can discuss are when the sponge-like meshwork that filters the fluid becomes compact and prevents fluid from entering into the canal. Another way is when the iris is pushed forward and covers the canal. In either case, the fluid buildup in your eye creates pressure that pushes on the back of your eye and damages the optic nerve, which is the nerve responsible for transmitting images that you see to the brain. This pressure over time can cause blind spots and even blindness. Normal vision occurs when light enters the eye through the cornea, then passes through the pupil and the lens, focusing in the center of the retina at the back of the eye. When a person has diabetes, they can develop damage to the blood vessels in the eyes that provide nourishment to the retina. The retina is a delicate, light-sensitive lining located at the back of the eye. When blood vessels in the retina are damaged, they may leak, swell, or grow brush-like branches and extensions. This damage is diabetic retinopathy. People with diabetic retinopathy may experience blurred vision, blank areas, or glare when in bright areas. As the disease develops, cloudy vision, blind spots, and floaters may occur. Floaters look like small spots that float across your field of vision. Left untreated, diabetic retinopathy can lead to blindness. Normal vision occurs when light travels through the cornea, the clear covering of your eye. Light continues to travel through your pupil, which is actually a hole in the colored part of your eye called the iris, and then through the lens, which focuses the image onto the back layer of your eye called the retina. The light image is then converted to electrical signals that are sent to your brain. The lens must remain transparent in order for you to have clear vision. Cataracts occur when the lens becomes cloudy or opaque, preventing light from passing clearly through your lens. Cataracts are due primarily to age or other conditions. In normal vision, light first enters the eye through the cornea. The cornea is smooth and round, then through the pupil, and then the lens. After light enters the eye, it focuses at a single point on the retina at the back of the eye. Astigmatism is usually caused by a cornea that has an irregular shape and is more oval than round. This can cause light rays to focus at several points in front of and or behind the retina instead of on the retina, causing images to be blurred or distorted. People with astigmatism may also report frequent headaches or eye strain. Blurred or distorted vision caused by astigmatism can be improved by wearing glasses or contact lenses.